And then the rest is going to be spent on other elements of the Act, which I'm going to go through. Technical assistance, grants and loans, bless you, and a whole host of committees and other things that will move forward. So I think we'll see a pretty big chunk of funds move out to the field. Probably, my guess is, even if they got started today on developing the language, maybe it would hit at the earliest, the last quarter of '09, and maybe 2010. Yeah, it's going to be a while for these grants and loans to move out there. Now remember, that was by design. They didn't intend any money to be spent on Health AT until after the standards were ready, which would be 12/31/09. So, but there is some work that will be done prior to then. Okay, so what's going to happen? It says that the funding shall support the following things. Nothing wild and crazy here. All the things that you're thinking through: Health AT architecture, EHRs, training and dissemination of information, and other things such as telemedicine, and a whole host of issues. Public health. I know you have a very strong public health department. Here in Pennsylvania is referenced throughout the language. Now, let's get into what they must do. The first thing that needs to happen, and it's not optional, it's required, is a loan program, or I'm sorry, a grant program for states. States or state-designated entities. These are going to be used for planning and implementation. And again, I can tell you the spirit of the language was that maybe we could move the planning grants out before the standards were ready. I mean, when the staff were writing this language, they were sort of had a timeline in their mind around, okay, do all this work, get the standards in good shape by the end of the year, start moving the technical assistance out, beginning in '09, and there's some language, and then also look to getting those planning grants out. I know there was an intent to move those out fast, followed by implementation after they could say, you know, the Secretary has adopted this set of standards. So planning, we expect, but you know, again, we've got some vacancies, planning grants to go out here pretty soon, as well as implementation grants. And the feds, HHS is already, as you know, putting some money out to support these services. Here's a whole list of how the grant funds shall be used. This looks familiar, I know, to you. You know, getting broad and varied participation, right, across stakeholders, identifying state or local resources, complementing other federal grant programs, and providing technical assistance. Here, a whole host, you can see, you know, the different organizations that lobbied pretty hard, that lots of provisions sprinkled through the bill in order to address their particular areas. Well, it also calls not only for the money to go to states, but they can go to state-designated entities. And I suspect, and that's something that you're thinking about a lot. So what it's somewhat prescriptive in the language around what a state-designated entity is. Well, first of all, being designated by the state would be required. So getting that designation, in some states there are multiple entities, and so, you know, having endorsement by your state is important. Not-for-profit is a requirement. You would need to be not-for-profit with broad stakeholder representation, making sure that one of your principal goals is to improve health care and addressing conflict of interest and non-discrimination policies, so open, fair participation by all stakeholders. And they actually prescribe who needs to be at the table, which is good. You see this throughout, making sure that this is broadly based and many stakeholders are at the table. Some matching funds are required in 2011, but it enables the Secretary, and I know many of these initiatives are not well capitalized across the country, and so it does enable the Secretary to not require matching funds prior to 2011 as this moves forward, and I think that's very important, particularly now where access to capital for all of us, whether you're hospitals, even small physician offices and entities, is pretty tight given the economic crisis that we're in. That's required. There's another optional program, I'm watching my time here, an optional program around a loan program. We actually put together some fairly lengthy policy proposal about 4 years ago regarding this. So what is this thing? And it doesn't have to be done, but there are probably 3 or 4 pages describing what it would look like. Basically, the federal government would provide funds to states to use for loan funds. And then the states would be able to also capture funds from the private sector for those loan funds. And those loan funds, in turn, would be lent out to address some of the capital requirements, particularly for small physician practices, for not-for-profit hospitals, and the like. And that's what this is all about. And it's for purchasing and using health IT. In the interest of time, I'm not going to spend too much time on some of these other research centers. There are a number of research centers that are sprinkled through. I'm going to spend a bit, probably most of my time, the next 10 minutes on technical assistance and the Medicare incentives, because I think you're going to see more language coming out on this in the next 80 days. So the first is this Health IT Extension Program, and this one's not so clear. So there are 3 programs. And this one, it doesn't say a lot about, but it's basically that the federal government itself will establish an extension program to help providers. So that's number 1. Not too much data regarding that, and I'm not sure how that would work, actually. The second is there are 2 entities that are linked. The first is a research center, and this is sort of, when I look at this, we're a subcontractor in the ARC National Resource Center for Health IT. You know, this looks and feels a lot like that, but probably expanded with more funding. So basically the idea is that there would be a center nationally that would bring together best practices that would, you know, that could be utilized by others across the country, and the government would put some money into that. And there's a long list of things. Again, when you get the slides, you'll see what's in that center. This is the interesting part, though, and I'm really thrilled to see this. Actually, I think the technical assistance part is the part that needs the most work in the U.S. I really, you know, I knew we'd get to funding soon, but how you help, particularly small physician practices, and I know you're spending a lot of time in leadership, you know, on tackling those issues today. How you help small physician practices migrate is a huge, huge thing. It's labor intensive. It's hard. There hasn't been a great market for it to date to allow entrepreneurship and innovation to happen, but it looks like this will help us get there, and particularly the Medicare incentives will probably be the biggest thing that helps us get there, because it'll actually create a market. But here, the idea is that there would be regional extension centers across the country that need to be affiliated with a nonprofit. It's not clear that you need to be a nonprofit yourself. And the idea is that you would help support, provide boots on the ground, if you will, with implementation of health IT. Again, you need broad participation. You need to use the best practices that come out of that, the hub or that center nationally. And there are a whole range of things that this would be required to do. What's interesting is it also says priority-wise, you got to focus on these guys first. The public or not-for-profit hospitals, the small physician practices, our community health centers, and those that support the underserved, which is really good, and then and very much needed. And then the rest, you could provide services to for-profit, but I think you would be maybe competing with forces that are already in the marketplace. So I think this is designed, again, this is Marchibroda analysis of the language, to really help the areas that aren't being served today as this moves forward. They can receive financial support up to 4 years. They've got to have matching, 50% of the capital, and this is the big part. This one's going to move fairly quickly, actually, and it should, because we've got a lot of getting ready to do before the incentives move out there. So less than 90, I guess we're 80 days out. The secretary shall publish in the Federal Register, you know, a detailed description of the program, an RFP, if you will. I don't know if technically you have to put the solicitation on the street within 90 days. It looks and feels like that to me, and then they'll be subject to merit review. So I'm excited about this. We really need this across the country in a big, big way, and this is one of the things, along with standards, that will move fast, fast.